Welcome to Open BxRx Tuesday on BronxNet. I am Javier E. Gomez, filling in for Kibin Aline, who is off today. Remember to follow the show on Instagram and Twitter at BronxNet TV and also on Facebook at BronxNet Community Television. Everybody is talking about baby formula shortages around the nation. To tell us more about what parents and caregivers should know, we welcome Dr. Denis Traore, Nursery Hospitalist at Montefiore Weiler Hospital. Welcome, doctor.
Hello, thank you for having me. How are you doing?
Doctor, what are you finding when it comes to these baby formula crisis?
With the prices that have been price gauging that has been going on due to the shortage, so some people are actually hoarding and trying to resell the formula at a higher price.
In terms of the actual situation, is there reason to panic because some people on the street are quite concerned?
Yes, so as you mentioned, it's not only something we see in our Bronx community, it's a nationwide issue. So the most recent data showed that more than 40% of the formula has been out of stock. But it's important for families to know that they should remain calm and should not go into panic mode because there's still options available.
Doctor, we were talking off camera that most of the baby formula shortage conversation has centered around economics and politics, but that very seldomly the matter has been addressed from a healthcare and health perspective. So talking a little bit as it relates to health, what can parents or caregivers do if the formula they need is either not available or if it is being recalled?
Yes, so for most babies, healthy babies, they can actually use store brands or generic formulas since they still go under this very stringent FDA approval. So these are options, but of course, the babies too require specialized formulas. For example, if they have any chronic medical conditions, rare genetic conditions, or allergies. In those cases, it's very important for them to consult with a pediatrician or family physician in order to find appropriate alternatives for these specialized formulas.
Can parents and caregivers dilute the formula to maximize it?
Most definitely not. So infant formula is specifically designed to be very close to breast milk. And so there are specific nutrients that babies require. So we most definitely do not recommend families, caregivers, to dilute the formula because it can lead to electrolyte and nutritional imbalances, which can lead to dehydration, even seizures. And there have been hospitalizations due to diluting our formula.
Doctor, I have seen in the last few days hundreds of baby formula recipes floating around the internet and social media. People giving each other tips: use goat milk, add vitamin powder, add molasses, do this, do that, grind cassava into it, grind noodle into it. But are these safe?
We do not recommend making your own formula. Again, so there are very strict nutrition requirements that are important for the growth and brain development of babies, which formula from the store or breast milk provides. So there, again, it can be quite dangerous for the infant if there are any imbalances in the nutrients.
Doctor, so people can understand why it is probably not a good idea to improvise baby formulas with home ingredients. What is it that baby formula must deliver to a child?
Yes, so there are specific nutrition requirements. For example, the type of protein, the amount of protein, electrolytes like sodium, calcium, that has to be maintained in order for the baby to grow and develop normally.
Now, doctor, just so we can clear the record, are there any circumstances in which it would be a good idea to improvise a formula at home?
Most definitely not. And I also want to emphasize that until 1 year of age, babies should only consume the type of milk that's either human breast milk or formula. So definitely we discourage introducing any goat milk, cow milk, because these again can have severe health consequences for the infant.
Doctor, in your experience at Montefiore, are you finding anything regarding how parents or caregivers are dealing with this shortage, given different ethnic backgrounds? I know some groups have different produces and different cultural approaches to raising a child and feeding a child.
So at Montefiore, we always try to be culturally sensitive and also provide the most scientific and accurate data when we talk to our parents. So we definitely see that there's concern, but we always try to help and support our parents. So we start from the get-go in the nursery. We always encourage any mother that's able to breastfeed, since that's the most nutritional value that babies can receive. But of course, there are some mothers who are unable to breastfeed due to medical conditions, or for the baby's medical conditions, or just because they don't have the time due to their job. So in those cases, of course, we provide formula, and we always want to make sure that they know that we are here to support and help them.
When can babies begin ingesting solid food, and what can that food be?
So we can introduce solid foods such as fruits, vegetables, rice cereal at 4 to 6 months of age, but it also depends on the developmental status of the baby, so that there's good oral motor coordination, and also that there's head stability.
Now, doctor, when can babies, if ever, transition into regular cow's milk, fresh milk, as we call it in the stores?
Yes, so we recommend after 1 year of age that we can introduce cow milk.
Is it recommended to be used plain or any specific method?
No, so it can be just regular cow milk.
Now, doctor, this whole situation with baby formulas makes me think about food insecurity. How big of an issue remains food insecurity, at least here in Bronx, in the borough?
Yeah, so in our borough, it's actually so we actually have the highest rate of low economic status from any of the 5 boroughs. So it's definitely something that we see a lot. Hence at Montefiore, we not only try to address the medical needs of our population, but also the social needs. So we have several screens in our inpatient and outpatient side that screen for food insecurity, housing insecurity. And so as physicians, we work very close with social workers, local programs and organizations, as well as community healthcare workers in order to address those needs.
What can people do if they are struggling with obtaining baby formulas?
Definitely, the first thing should be to consult a pediatrician or family physician in order to direct them if there are any generic alternatives that meet the unique nutritional needs of their specific infant. And also, if babies are in a special care formula, there are some alternatives that are equivalent and can meet those needs. And most recently, the FDA also stated that in very urgent life-saving situations, they may actually release some of these specialized formulas that were on recall, but it's on a case-by-case basis and requires the doctor's note.
What resources are there at Monty for parents and caregivers?
Yes, so we work with Bronx Healthy Start, which supports parents and caregivers, as well as also the WIC office, which is the specialized nutritional supplemental program for women, infant, and children, with whom we also work very closely with. And there are also several other local resources that we also can direct families in need to.
Thinking beyond baby formulas, doctor, how can you describe a healthy diet for an infant?
Yes. So most definitely for the first 4 months of life, so the newborn period, baby should only consume either formula or breast milk. Thereafter, if they meet all the milestones, we may introduce solids between 4 or 6 months of age, such as fruits, vegetables, rice cereal, and then we continue. So if babies are feeding solids well and are between 9 and 12 months of age, If there's a need, you can actually increase the amount of solids if you don't have the amount of formula also available, in order for your baby still to have all the nutrients and calories that they need in order to grow.
Previously in the segment, you mentioned some short-term conditions of malnutrition or improper nutrition in an infant, but can you tell me a little bit about what could be some long-term consequences of improper nutrition in an infant?
Yes, it actually can have quite drastic consequences. So if there's inadequate amount of calories, certain fatty acids, it can lead to improper brain development and can have long-term consequences with regarding to their development. As well, if they have inadequate amount of calories, they may be underweight and have a slower growth rate as if you provide it normally. And also introducing cow's milk can also affect the GI system as well, and can also lead to anemia.
Thank you for that information. Dr. Denis Traore, Nursery Hospitalist at Montefiore Weiler Hospital.
Okay, thank you very much.
We'll be right back with Open BxRx Tuesday.